Hello, everyone, and welcome to episode 2 of Health Talks at Healthy U Clinics. I'm Kendra Collins, manager of community events, here with Dr. Alexander Didick, our director of pain medicine. He's here with me today to talk about all things related to dealing with pain during physical activity. Dr. Didick, to get us started, tell us a little bit about your role here at Healthy U and how you educate patients on how to enjoy physical activity while managing their pain.
Thank you, Kendra, for the wonderful introduction. I really appreciate it. I am the director of pain medicine here at Healthy U Clinics, going on my second year at Healthy U. So I'm a board certified family medicine, as well as board certified sports medicine, and as well as board certified pain medicine physician here at Healthy U Clinics. And physical activity is a really important role in my life, both taking care of athletes and just everyone, right? So everyone should be physically active. It's very important for us both from a health standpoint as well as our mental health, right? I think there's a lot of components to make up who we are, how we do things on a consistent basis, right? And physical activity has to play a role, regardless if we're very sedentary right now or we're someone who is actively exercising on a consistent basis. There's ways to improve our activity as well as kind of grow faster, stronger, be able to reach different milestones in our physical activity. And everyone has different goals, and that's fine. We're starting with patients who often are sedentary, as well as people saying, hey, I would like to be better or achieve this goal. And we're kind of setting out to kind of help patients achieve whatever goal they need. Sometimes it's from a baseline of, I can't get up and walk around my home. I can't do my normal physical activities in terms of taking out the trash or being able to do laundry, right? Or the other end of the spectrum is, we'll take care of a high level athlete or someone who's a marathon runner who is really trying to stave off injury in various kind of ways as well.
Yeah. So it really just depends on where the patient is at and what their goals are. So what are some examples of a few exercise routines that can help someone who's dealing with pain from, a little bit of pain to a lot of pain? What's your recommendations for them?
So when I was in my sports medicine fellowship, it was an interesting time during COVID-19 in the middle of the pandemic, where lots of our athletes that were taken care of were very sedentary. Gyms were closed; they couldn't do anything. If you recall, people were instructed not to go outside. I mean, you're kind of leaving your house, right? So people are very, very limited. And for the first time that we can kind of remember that you took a very even active population and you made them sedentary. And multiple studies have been kind of done historically, even just showing if you took someone who was a high level athlete and you put them in a hospital bed, let's say for 2 weeks, that they lose a very significant portion of their muscle mass and their cardiovascular fitness. The reason why I make bring this all up, our goal became, how do we put people back into physical activity safely from going from a sedentary standpoint? And what we kind of discovered is there's kind of a safety zone in terms of how quickly you can kind of progress to being sedentary to basically reaching your kind of peak physical condition or whatever that established baseline was. And I think that's a really kind of important point, right? So you're not going to learn how to run a marathon if you don't run in 6 weeks. That's just not going to happen, right? It takes time, a kind of progressive kind of to help us to kind of get to our goals. And so again, it does really matter where we're starting from. It does matter what our injuries are. It matters what we're kind of our day in and day out activity levels and what we can fit into our schedule. But there are general guidelines of how much physical activity someone should have that have been kind of released for multiple different societies. And a lot of times we're saying, hey, at least we're trying to have at least 30 minutes of physical activity on a daily basis. Now that can add up, right? So you can do 30 minutes here, 30 minutes there. You can do 60 minutes here. You can say it's moderate physical activity, right? If someone's kind of riding a bicycle or going on the treadmill, just getting their heart worked up a little bit, or it could be even a couple of days a week of vigorous physical activity where someone's significantly huffing and puffing and getting a good sweat while they're exercising. There's cardiovascular fitness on one side of this, which is your cardio from your walking to your swimming to your riding a bicycle to going on the treadmill, the Stairmaster, you name it from that same point. Also, when people play sports, a lot of times there's a strong physical, a cardiovascular component to it as well, right? If someone's actually playing basketball and they're running up and down the court constantly, that counts, right? If someone's shooting hoops and not moving and standing still, maybe not so much on that side of it too. There's also recommendations in terms of being able to do resistance training, which a lot of times is what we call lifting weights or working out, a lot of times in the gym, where we're often recommended hitting each muscle group in some capacity, which includes, muscles for kind of the chest, the back muscles, and the legs are kind of your major kind of muscle groups. Hitting those some ways on a consistent basis, which a lot of times is broken down to a recommendation of minimum about twice a week that you're kind of doing that. And then the last kind of component of this that's very kind of critical is flexibility, right? And so there's a lot of different ways that we kind of justify what flexibility is, but in some ways, either stretching program, yoga, those things are definitely recommended about once a week in some capacity, right? And so every one of us has a different need, right? Some people say, "Oh, I'm so used to running, or I'm so used to kind of walking, and my cardiovascular fitness is good," but maybe they don't lift any weights, and so there is deficits that kind of go there. Or someone lifts weights and they do cardio, but their flexibility is very, very poor, and so this puts us at risk for various injuries because those injuries start occurring because those are kind of the weakest area in our chain, right? So if we have a tendency to overwork one muscle, but then we underwork other muscles, those become kind of injury plagued in a lot of ways with patients. And we see that kind of reoccurring over and over again.
Yeah. I think it's important for those listening to know that you personalize a routine for them by listening to what their symptoms are. And not one size fits all when it comes to, working out, especially those who are dealing with pain. And sometimes just getting ourselves into better shape can alleviate pain. When a patient asks, how do I get myself into better shape? What do you recommend to them?
So this kind of piggybacks off of one of our previous kind of talks that we kind of talk about a little bit about weight loss, which is, you know, a lot of times when someone says they're quote unquote out of shape, we have to kind of overall look at what does that mean, right? Are we having issues in terms of our health outside of just physical activity? Are we having difficulty with sleep? Are we having difficulty with stress? Are we having multiple health concerns that are going hand in hand where we're struggling with? So if I see someone who has uncontrolled diabetes, one of my first kind of conversations with them is saying, we need to get this under control. I see patients in chronic pain. Maybe someone has a very bad back in some ways and has a lot of degeneration. It's very hard to help someone get into shape if they are struggling with pain. It's very hard to get someone in shape. Sometimes I see we do a lot of hormone management as well for men and women at HealthyU, and we'll have patients who are going through menopause, or what we call male hypogonadism for men as well, with its low testosterone, and they can have very severe fatigue, as well as muscle aches, pains, muscle recovery, meaning when I feel like I go clean the garage, I'm wiped out for multiple days. And so we're trying to optimize a lot of other health concerns as well to be able to really focus on improving our physical activity. This is also one of the reasons why we have such a large focus on things like weight loss. So every one of us, if we feel like we are carrying too much weight, I don't tell patients how much weight they have to lose. I'm saying that it plays a very significant role in our health as well as our physical activity. It goes hand in hand with this. I really do kind of equate it to, if we feel like we're 50 pounds overweight, it really is holding a 50-pound dumbbell, walking around every single day. So if we picture a time period where, say, I felt like when I was 25 years old, I felt great, and now I'm 35 years old and I don't feel great. It's not because we're 35. I think a lot of times we equate age as the problem. It's a lot of times the health concerns that go with aging often, and sometimes it boils down to our weight increases as we age, which is very common to see. Someone will gain even a pound, 2 pounds, 3 pounds in a year. We multiply that by 20 years, and someone's 60 pounds heavier than where they wanted to be. And that really is, they were walking around with, a loaded backpack with bricks for during that time period. And then when we help them lose weight, it's amazing how much energy someone starts kind of picking up. And it's much easier to start new physical activity routines when other aspects of our health are being optimized.
Yeah, that's such good insight. A lot of times patients are seeking help for their pain that is directly related to an injury, whether it was sports related or maybe they just fell at home. A lot of elderly patients deal with that. What is the recovery process like for some of these patients, and what types of services in pain management do we do here at HealthyU that can help some of these patients?
That's a great question. It's a loaded question in some ways too, right? So we want to break things down into, is this an acute injury? Is this a subacute injury, which is usually after about 3 months? A lot of times we're basically outside maybe the first 6 weeks to about 3 months, or 6 weeks to about 6 months marks, depending on what we're saying, in chronic pain, okay? Because these things are different. So chronic pain by definition is pain or an injury of some sort. Anything can be considered an injury. It could be a nerve injury. It could be I fell down and I hurt something. It could be I had surgery in this area before and now the tissue's been damaged. I was in a car accident. All of these things could be degenerative, right? Kind of wear and tear. But anything that is chronic, usually over 6 months in duration, it is outside of the normal healing time period, meaning I'm not necessarily expecting this to get better on its own. One of the biggest, worst kept secrets in medicine is our body likes to heal itself, right? And so there's an old saying, I'm a DO, as an osteopathic physician, the oldest kind of saying is, we're distracting the body while it's healing itself, right? And so that is an integrative and holistic approach to kind of taking care of patients. And if you're taking care of patients from that standpoint is, we want to identify is this something that we expect to get better or not? And I saw patients today that we're having this kind of conversation with, which is sometimes that healing time period is much longer than people want it to. If I stub my toe or I sprain my ankle, a lot of times the expectation is this is going to get better over the next week or two, right? If I herniated a disc in my back, it may take months. It's a lot of times it can be close to a year, unfortunately, in some cases, before this is getting better. But we still expect the vast majority of those cases to get better. And so we have different modalities that we're trying to help patients with, depending on where they're kind of falling on that spectrum. If I'm dealing with someone who's got very severe chronic arthritis in their back, it's been going on for 20 years, it's a very different approach than someone coming in to see me that their pain's been only there for about 2 weeks, and we're trying to negate that in some ways. And that's why it kind of falls into this acute, subacute, and chronic, because you really can kind of fit things into there. There's an also just very common, how do you deal with a sprain or strain? We call it RICE, right? You rest, you ice, you compress, you elevate something. You might be taking some pain relievers. You might be doing some physical therapy or doing some home exercise program if things aren't getting better. But if it's getting outside of that, then we're kind of progressing up the treatment algorithm. And so that treatment algorithm is dependent on the injury. There's a lot of detail that goes into it, but a lot of times we're integrating maybe different kind of medications. Maybe we're integrating maybe some advanced imaging to kind of really see what's going on, like an MRI at that point. A lot of times I'm starting to utilize something like injection care, which is kind of a lot of times if you're using a steroid in that example, it's putting like 1,000 ibuprofen right up against the area of pain and see if you can kind of help it. And then if we're dealing with chronic things that aren't healing, then we're kind of debating about saying, hey, is this someone who needs to be medically managed in some way? Are we utilizing injection care? Sometimes we do things like ablations where we burn nerves, or stimulation where we stimulate nerves with electrical impulse. Or is there some minimally invasive procedure we can do to manage that? And so this is a progression a lot of times too. You're not going to do these kind of chronic treatment modalities for someone who's been presenting to you with symptoms for 6 weeks at that point, because it hasn't had time to heal. There's also issues in pain as well as kind of chronic injuries that may have benefited from other types of modalities early. Meaning, if I sprain my ankle and I don't do anything about it, you're much more likely to develop chronic pain and chronic ankle stability than someone who was managing it acutely, or if it wasn't getting better, doing therapy and rehabbing it. So we also want to avoid things as much as possible to become chronic pain. The rule in chronic pain is stopping chronic pain before it happens. This is kind of outside the scope of this kind of talk, but it's very challenging to deal with chronic pain because the pain kind of takes a life on of its own. And so as much as I can manage someone to avoid those kind of chronic pain problems that start occurring over time, the better off the patient will be.
Yeah, absolutely. Dr. Dick, this was amazing. Thank you so much for your time. If you are a patient right now listening and you can relate to some of these things that we've talked about, please reach out for an appointment, 602-491-0703. We are here to help you. And Dr. Didick, if you have any last comments or anything you want to add, please do.
I think thank you, Kendra. I really appreciate it. I think one thing that we want to do, because we're reaching out to our patients and we want them to feel like they have a voice and someone they can kind of listen to, as well as if you have questions, please let us know, right? We don't kind of disclose kind of patient information and stuff like that, but people just generally have questions about their health, right? And we're happy to, we're happy to talk about this. And so, the best kind of place to get this information is directly from patients. So,
right. Yeah.
Thank you.